Welcome, curious minds, to another deep dive. Today, we're plunging into a really critical question. After everything the world has experienced in recent years, how ready are we, really, for the next respiratory pandemic? Our mission today is to crack open the World Health Organization's, the WHO's, Tracking Global Progress on Preparedness for Respiratory Pandemics 2023 report. This isn't just some dry review of what happened, it's meant to be an annual snapshot, designed to inform what comes next, to help us understand where the world stands in building its defenses.
Exactly. And this report, it gathers insights from 13 key indicators across five really crucial capacity areas. Our goal for this deep dive is basically to pull out the most important nuggets of knowledge and insight, giving you a real shortcut to being well-informed on a topic that, well, it affects every single one of us.
Right. And those five core areas, the pillars of preparedness, if you will, are emergency coordination, collaborative surveillance, community protection, clinical care, and access to countermeasures. Think of it as a kind of comprehensive blueprint for global resilience. Okay, let's unpack this. Let's kick off at the absolute foundation, emergency coordination, starting with those national preparedness plans. The WHO launched its Preparedness and Resilience for Emerging Threats, or PRET initiative last year to guide countries. So what's the report tell us? How are nations doing with these essential plans? Are they actually putting pen to paper?
Well, this first piece of data is quite sobering, actually. As of late 2023, only just eight out of 194 countries had actually developed or updated their national plans for respiratory pandemics since that WHO PRET guidance came out in April 2023.
Only 8. Wow.
Yeah. To put that in perspective, that's less than 5% of member states. Now, okay, 10 more were drafting and 71 were in preparatory work, but that still leaves a staggering 101 countries, over half the world, without a concrete updated plan in place.
Over half.
Imagine, a vast majority of the world's cities having no updated disaster plan for a major earthquake. That's kind of the scale of this gap, leaving over half the world potentially, well, improvising when the next major threat arrives.
Wow, that really does highlight a fundamental vulnerability, doesn't it? It's not just about having a plan on paper, though, is it? What about actually testing those plans? I know the report mentions some real-world examples, countries working on this. What stood out there?
It did, yeah. We saw India, for instance, conducting a massive national consultation on its pandemic preparedness plan for respiratory viruses, which is, a significant move for a country of that size.
Huge, yeah.
And countries like Costa Rica and Lebanon, they're actively using simulation exercises to test their readiness, which is great. But what's fascinating here, though, is that next step, actually exercising these plans. Simulation exercises are vital for testing capabilities, finding the gaps before a crisis hits.
Right, the fire drill analogy.
Exactly. The report reveals that only 7 countries had even run comprehensive simulation exercises like that full-scale fire drill for a pandemic since 2022. Only 7.
Just 7 globally.
And here's a really crucial detail. Of those 7, only 3 had actually taken the lessons learned from their drills and integrated them into finalized, updated plans. The other 4 still working on it, or, the findings were just sitting there.
So it's like having the fire drill, finding critical flaws, like the exits are blocked.
And then just filing the report without actually unblocking the exits.
Yeah. That point about integrating lessons learned is absolutely critical because, even the best plans are useless if we don't know what we're planning for, right? Or if those plans aren't adapted. And that brings us neatly to the next crucial piece, collaborative surveillance. How well is the world sharing its intelligence, its data, to spot these threats early? Why is robust data sharing, especially across borders, so important?
Oh, it's absolutely vital. Pathogens, well, they don't carry passports, do they? What starts in one place can become everyone's problem very, very quickly. The report uses influenza surveillance as a kind of benchmark. In 2023, 127 countries reported their flu data to the WHO's global system, GISRS.
Okay.
Now, this system is crucial because it helps scientists everywhere see outbreaks forming, ideally in real time. But of those 127 reporting, only 46 reported consistently and in a timely manner.
So timeliness is key.
It's a major challenge. So while many are reporting, the speed of that information is still lagging for a lot of countries.
Okay, so that's influenza. But as we know, pandemics aren't just about flu. Are we getting any better at tracking a wider range of these respiratory nasties?
This is actually an area where we do see some real progress. And yeah, it's encouraging. 114 countries are now consistently reporting virological surveillance data on both influenza and at least one other respiratory pathogen, things like human coronaviruses, RSV, adenovirus, to this WHO system called Respimart.
Respiratory, okay.
And that figure, 114, that's a 12% increase from 2022. Every region showed improvement here. So it means we're sort of expanding our eyes on a broader spectrum of potential threats. You see examples like strengthening public health intelligence in the Eastern Mediterranean region, things like that.
That definitely sounds like a significant step in the right direction. But, speaking of cutting-edge surveillance,
Yeah.
let's talk genomic sequencing. This is how we track variants, understand how a virus is changing, right? How's the data sharing looking for that critical area?
Yeah, this raises an important question, really, about sustaining critical capacities.
Yeah.
In 2023, 129 countries submitted SARS-CoV-2 genomic sequencing data to GISAID. That's the big global platform for sharing these genetic blueprints.
Right, GISAID. Heard a lot about that.
Exactly. But here's the catch. That number, 129, reflects a significant 22% decline from the year before. That's 37 fewer countries consistently sharing this vital data.
A 22% drop. Wow. Why?
Well, the reports suggest this decline is somewhat anticipated. As the pandemic response evolves, things scale back maybe. But, and this is but it absolutely underscores the critical need to sustain this capacity. Because if we're not tracking variants as closely, we could be much slower to detect new, potentially more dangerous strains. Slower to understand how they spread, how severe they are, and slower to adapt our vaccines, our treatments. It's a classic example of, capacity erosion once the immediate crisis seems to fade a bit.
That's a really powerful point, like losing our eyes on the virus just when we think the storm has passed. Okay, let's shift gears now. Let's turn our attention to community protection. And starting with a challenge that really exploded during the last pandemic, infodemics, that flood of information, some good, some bad.
Oh yeah, the overwhelming wave of information and misinformation during a health crisis, making it so hard for people to know what to trust.
Exactly. So what does the report say about how countries are monitoring this health misinformation? Are they even tracking it?
Well, it's a newer area they're tracking in this report, and frankly, it highlights a vast gap. Only 17 countries regularly conducted infodemic monitoring and analysis. Actually tracking the misinformation and sharing insights at least every 3 months in 2023.
Only 17.
17. Now, 13 of those reported even more frequently, which is good, but that leaves a staggering 111 countries not reporting at all.
Wow.
Yeah. Misinformation, as we know, it can spread like wildfire. And if countries aren't even tracking it systematically, they can't possibly begin to combat it effectively. It's a huge blind spot.
That is a tough one for sure. So, okay, beyond just monitoring the bad info, what about the flip side? Proactive communication. How are countries doing with getting essential, accurate health information out to their populations?
Well, in 2023, 155 countries indicated they were implementing public risk communication activities at the national level. Now, that sounds like a pretty good number.
Yeah, sounds high.
But it's actually a slight decline, 3 fewer countries than the year before. Trends do vary by region, but you see examples like Bolivia actively tackling vaccine hesitancy, which shows these proactive efforts are still happening in some places to ensure people get trustworthy information. It's just not universal and maybe slipping slightly overall.
Got it. And finally, for community protection, let's look at a more traditional measure. Border protection. How are countries doing with having plans ready at their points of entry, airports, seaports, land crossings?
This is actually one of the more positive stories in the report. 127 countries had developed public health emergency contingency plans for all their designated points of entry, or POEs, in 2023.
Okay, that's better.
Yeah, much better. This is an 8% increase from 2022, and there was progress in 4 out of the 6 WHO regions. It really suggests a growing recognition of how important it is to try and prevent international spread right at the borders. Seems like a clear lesson learned from previous outbreaks is sticking, at least here.
Okay, good to hear some positive trends. Let's move now to the real front line of defense. Clinical care. What does the report tell us about infection prevention and control IPC in hospitals and clinics? This is so crucial for protecting patients and healthcare workers.
Right, so the report shows that 131 countries were implementing active IPC programs using what they call multifaceted strategies at the national level in 2023. This is actually a tiny decrease, just 1 country less than in 2022.
Only one. Okay.
Might seem small, but the report really emphasizes that continued commitment to IPC remains crucial for preparedness efforts. Even a slight dip is a bit concerning, especially when you think how vital these practices are in stopping infections spreading within healthcare settings during an outbreak.
Absolutely. And during a pandemic, it's not just about treating the new disease, is it? It's also about keeping all those other essential health services running. Routine checkups, managing chronic diseases, maternal care. What does the report say about ensuring that continuity during a crisis?
Yeah, that was a huge challenge last time. So in 2023, 107 countries had a mechanism in place, both nationally and subnationally, to actually monitor the continuity of essential health services during an emergency. This is a very modest increase, just one more country than in 2022.
Slow progress there.
Slow progress, yeah. But we are seeing examples driven by recent experience, like Fiji focusing on innovation for oxygen access, which becomes so critical, or Lesotho working on strengthening its ICU bed capacity. These are direct responses to the strains we saw in healthcare systems.
Right, learning from the pressures. Okay, and now to that final pillar, access to countermeasures. Getting the tools, the vaccines, the treatments we need to fight these things. Let's start with regulatory approval. How quickly can countries actually greenlight new products when time is absolutely critical?
This is an area with considerable room for improvement. Frankly, it looks like a critical bottleneck. Only 33 countries had fully implemented a defined regulatory approach that allows for timely approval of pandemic products in 2023.
Just 33?
33. And that's actually a slight decrease from 35 in 2022, though they say that might be partly due to changes in how they measure it. Still, 59 countries had only partially adopted such an approach. And maybe most worrying, information was simply unavailable for 97 countries.
Nearly 100 countries we just don't know.
We just don't know if they have a fast-track system. This isn't just a data gap. It's a major potential delay. If a new pathogen emerges and we develop a vaccine or treatment, almost half the world either lacks clear pathways to approve it quickly, or we simply don't know if they do. That delay translates directly into, well, more illness and potentially more deaths.
That is a huge hurdle, especially when speed is everything. Okay, what about the availability of vaccines themselves? The report uses flu vaccines as a kind of benchmark, right?
That's right. So 130 countries reported that influenza vaccines were available nationally in 2023. Again, a slight decrease, 3 fewer countries than in 2022.
Another small dip.
Another small dip. But the report specifically found something interesting. Countries that already have strong established seasonal flu vaccination programs tend to be much faster at rolling out pandemic vaccines when needed.
That makes sense. The infrastructure's there.
Exactly. They already have the delivery systems, the cold chains, the trained staff. Liberia is mentioned as a good example, integrating COVID-19 vaccines into their routine immunization programs to sort of leverage those existing systems effectively.
Okay, now for the really big question, maybe. Global manufacturing capacity for pandemic vaccines. If a truly nasty pandemic hits, can we actually make enough vaccine doses quickly enough for everyone?
Yeah, this is where it gets really interesting and complex. The report offers some estimates for pandemic influenza vaccine capacity in what they call a moderate case scenario, assuming, say, you need twice the normal amount of antigen per dose. Global production could reach about 4.13 billion doses annually.
4.13 billion.
Yeah. In a best case scenario, everything running perfectly, optimal conditions, maybe you could reach 8.26 billion doses.
8 billion. Okay, that sounds like a lot.
It does, but there are some big caveats. These estimates largely assume the traditional way of making flu vaccines, using chicken eggs. Crucially, they do not include potential capacity from mRNA pandemic influenza vaccines.
Why not? The mRNA tech was so important for COVID.
Simply because, as of the report date, there were no licensed mRNA influenza vaccines yet, so they couldn't officially count that potential capacity. Also, even those billions of doses, that capacity isn't evenly spread around the world, and getting it produced, finished, and distributed globally in rapid order is still a massive logistical challenge.
Got it. So the numbers are big, but maybe not as reassuring as they first sound, with lots of ifs and buts. Okay. We've covered a lot of ground. After this really comprehensive deep dive into the WHO's 2023 report, what does this all mean for us? What are the really big takeaways from this snapshot of global preparedness?
Well, I think the report really tries to synthesize both the progress and the remaining gaps. It acknowledges the innovations and the steps forward made during COVID-19 and notes that some of those gains have been sustained. We talked about those positive trends, right? The 12% increase in broader virological surveillance reporting to Respimart, the 8% increase in border contingency plans. Those are concrete improvements. That's good news.
Always some good news.
But then you have the concerning declines, especially that big one. The 22% drop in sharing SARS-CoV-2 genomic sequencing data, And while the report, as I said, notes this was somewhat anticipated as things scale down,
It's still worrying.
it's still worrying.
Yeah.
It really underscores that critical need to sustain these capacities. We just cannot afford to let essential capabilities, things we built up at great effort and expense, just diminish because the immediate crisis isn't front-page news anymore. The report also clearly flags clinical care and access to countermeasures as areas needing significant ongoing improvement.
So still lots to do there.
Definitely. And I think the real key looking ahead will be how well countries continue to not just develop these plans, but update them, and most importantly, rigorously test them through exercises, and then actually act on the lessons learned. That's how we'll enhance readiness for whatever comes next.
So as you listening reflect on this snapshot of global pandemic preparedness, what really stands out to you most? Are we, as a world, leaning enough into those hard-won lessons? Or is there a real risk, as we've discussed, of critical capacities diminishing as the immediate crisis fades further from memory? Something to think about. We certainly encourage you to continue exploring these vital topics.